Okay, you guys. So first of all, I'm the dummy who wore a partially green shirt on a day when I was recording in front of a green screen, which is what I used to do this. So I'm going to keep myself in the bottom corner here and just stay out of the way for now. Also, I was just recording this for a little bit, and as we're talking about conditions of the eye and blindness, and I was in my garage this weekend working on a wood project, and I realized that my glasses were so stinking dirty and fogged up that I had to clean them with my towel. And so it's highlighting my own self-care needs and my sight as something that I lack something of. So most of you, we'll get into this later too, but most of you at least wear glasses or contacts or something. And so this is one of those conversations where we're going to be talking about the medical condition and the way other people experience, sight loss and blindness and all that kind of thing. And it can be really easy to gloss over the fact that so many people have sight issues themselves, including myself. And we wear these things and we think, oh, this is just sort of normal. And when we're talking about these conversations about what is normal and what is abnormal and how would it affect us, imagine a life walking around without your glasses and the kind of things that would do for you. It can be a really fun exercise, which we can't really do because it's an online class, but it can be a really fun exercise to wear a blindfold for like an entire day or at least part of the day, and just see how that changes life, especially if you can pull this off at your workplace. It's really fun to do this. I've done this before where you spend like half the day in a blindfold. And for somebody like myself, that sort of makes it impossible for me to work at the computer. I would have to learn a whole new way of functioning with a computer because that's the way I primarily communicate and the way that a lot of other people communicate too. So it can be incredibly eye-opening to understand your limitations, not just by taking your glasses off, but by wearing a blindfold too. So it can be a really fun exercise, but I guess I won't talk more about that. Let's just get on to the slides here. So as we've been talking about in other chapters, we talk about classification or what does it mean? And one of the things that some of us in the classes have been noticing is that there is this spectrum that we were previously unaware of. When we're unfamiliar with something, it's so easy to see it in black and white. But once you start understanding the nuances of it, you can see it like there's different kinds of vision loss and different degrees of vision loss. And so that's something worth mentioning. So low vision or partially sighted is kind of the terms that we're going to be using for somebody who's just like myself, who has vision. Like when I'm a farsighted person, we'll talk about the terms in a little bit too, but farsighted means that I can make out that there's a camera in front of me and that, but I can't see the details of what the buttons say and that kind of thing. I can't even read the screen. I'm standing about, 4 feet away from the screen right now, and I can barely read it. Maybe if I squint, something like that. But then all the light comes in and it gets all weird and stuff. So anyway, severe vision loss refers to I thought this was a funny definition. The inability to read ordinary newsprint. Nobody reads newsprint anymore. I'm sure there's some people that read the newspaper, but it's just not that common anyway. Even without the aid of glasses. So even if I have my glasses on, I still have trouble seeing. That's what we call severe vision loss. Blindness means total loss of light perception. I don't know a ton about this exactly, but I would suspect that it's a person could be deemed blind, but maybe could see like light, but just everything's a blur or something. I don't know. Somebody smarter than me would have to tell me about that. One of the definitions we run into a lot of times, though, is legal blindness. Legal blindness doesn't mean that you can't see. It means that you can't see under these two conditions. One, visual acuity does not exceed 2200 or worse in the better eye with corrective lenses. So if I have glasses on or some sort of contacts, and if I have different vision in one eye, the best one can't see to the 2200th way. And sorry, Paula just poked her head around the window of my office and she's like waving at me. So I got distracted. Can't see in the better eye. Paula's one of the other faculty in here, for those who don't know. She works in the program and she comes to my office and knocks on the window and comes in to chat with me all the time. It's fun. But it's distracting when I'm trying to make videos. Anyway, so in one eye, if there's a difference in vision in one eye with corrections, and can't see to a certain degree, central field of vision is limited to an angle of 20 degrees or less. So we're talking like I don't really know what 20 degrees is exactly, but like imagine I can see through my hands this at this angle, not a 90 degree. This would be like 90-degree angle. 45 would be less. 20 would be like a very narrow sliver of sight. So when we're talking about things like having your driving privileges revoked because you can't see, you're legally blind, you can't see beyond this, you can kind of see where peripheral vision would be difficult, making driving really potentially dangerous for self and others. So that's what we're talking about here. I'm going to move the microphone just a little bit. Okay, let's talk about the types of visual conditions. Now also I'm going to skip over a lot of the biology that's in the textbook. What I really want to start doing more of is if I'm going to reduce the time of these lectures are lasting, I want to get away from just memorizing the biology. It's important stuff, and it's for those of us that are in the classes, it's really helpful to understand why these things work and how they work, because clients will want to know and you'll have conversations about them. But more importantly, if we're going to be counselors and therapists, either helping in the vocational sense or in a mental health sense or whatever, we really want to understand how these conditions, let the doctors deal with that and the nurses and all that stuff, deal with the biology of it and how that manifests as an emotional or functional or developmental condition, something like that. That's what we really want to spend our time on. But it can be helpful to know some of these terms because you will hear them. Refractory errors, or the improper bending of light through the eye. Refraction is when the light goes into the eye. If you remember from science class, you have your let's do it right here. You have your eyeball, and light comes in and goes, and it crosses at some point, the focal point we call it, and it flips over, and the light from down here comes up this way, and it hits the back of the eye, and then it turns into nerve sensations and it makes pictures. It's essentially what we're talking about here. Some terminology. Myopia is nearsightedness. That's when the light comes in and gets refracted at a different angle than it should. Hyperopia, which is farsightedness. That's what I have. It's the same thing. Just light comes in and it gets bent a different direction. If we were to look at a kind of a what do we call it? Like a map. I don't know if it's a map. A picture of the eyeball, and we see the cornea on the outside and the lens behind that, and then there's all this like fluid and gunky stuff. We'll call it for the non-scientist, for the social scientist, the non-hard science biologist kind of person who doesn't know the anatomy. I'll call it fluidy, gunky stuff. That's not a technical term. When it goes through those different places, either the cornea or the lens, and then through the fluid and all that kind of stuff, refraction just means different ways in which the light is bent in a way that doesn't work the way it is. It would be optimal to work. Astigmatism is an irregular cornea, meaning when the light comes down, it gets kind of bent and twisted. I have astigmatism in my left eye, which means that my sight is just different. It's a different acuity level than my right eye. That's basically all it means. And it just means because it's shaped differently, so the light hits and moves off in different directions. Kind of generically speaking, that's what it means. I'm going to get this one, I'm going to pronounce this one wrong, but presbyopia, a condition related to the relaxation of muscles. So we're not talking about, it's a refraction error, but when the muscles around the eye relax or the elasticity of the lens changes, it's usually due to aging. And I don't know why there's an extra bullet point there, but most of these presbyopia and the rest of them can also be corrected with lenses, glasses, right? If the light goes in and is hitting some way in the wrong way, a different kind of lens can change the way so it can move that light in the right direction to help correct vision. It's basically the idea there. Another condition is incoordination of the eyes. So an astigmus is involuntary movements of the eyes with a fixed gaze. In other words, if my head is staring straight ahead and my eyes kind of drift off to the side, something like that, that's called nystagmus. Or strabismus is where a misalignment of the eyes, or if you've ever heard somebody say cross-eyed, eyes can be crossed or they can be parted where one's looking here and the one's looking there. That's just an incoordination of eyes looking in the same place at the same time. Eye opacity is something probably most of us are familiar with. Scarring or clouding of the cornea, usually due to injuries, inflammation, or infection. We're not going to go into detail about what these mean exactly, but most of us have heard of cataracts that can happen in older age. Cataracts is a specific opacity condition. It's correctable with surgical implants. There are different ways in which, as you can see here, different ways in which infection of the eye or inflammation of just swelling, basically, of the eye or an eye injury, those can affect the clouding of the cornea, which makes it just harder to see through that part that's supposed to be pretty clear. A person could get a corneal transplant if there's like a scratch or some sort of thing that happens to it. Oftentimes these come from work-related injuries. So for those of us that work in the vocational arena of rehabilitation counseling, we see work-related injuries oftentimes, especially when people are working with like woods or metals or there's shrapnel, that kind of stuff. Excuse me. That's why when you hear like OSHA talk about eye safety and wearing protective goggles for like all kinds of stuff, chemicals, if you're working around chemicals, it's because of stuff like this. The eyes are sensitive to chemicals and objectiles. So projectiles, not objectiles. Look at even the translation says objectiles. You're not getting it right, buddy. That's what it's telling me. So keratoplasty can be a surgical transplantation of the cornea. Basically, that's what that is. Inflammation or infections. We talked about this before. If anybody's heard of the word pink eye, the technical term is conjunctivitis. The inflammation of parts of the eye. We'll just leave it at that. Basically, that's what that means. The membranes of the eye get infected and then kind of like swell up a little bit and get irritated. That's basically what we're talking about here. Pink eye is just one version of that, but it can be other things too. Okay, glaucoma we talked about a little bit. We mentioned it. Or no, we didn't. We talked about cataracts. Glaucoma, it's one of those conditions that can be a primary condition. It can happen by itself, sort of standalone thing, or it can be a secondary thing related to diabetes, can be related to trauma, infections, prolonged medication use, like steroids can lead to glaucoma, or developmental irregularities. So it's one of those things that can happen to a lot of different kinds of people, a lot of different situations. And so most of us have heard the term before, but don't necessarily know what it means. There can be 4 different types of glaucoma. And basically what it means is that there's fluid buildup or lack of drainage in the inner eye. Remember that fluidy, gunky stuff that I was talking about earlier? Sometimes we think of the eye or even other parts of the body, like brain fluid, we've talked about this before, where it kind of flows in and out of the brain and maintains this sort of equilibrium, homeostasis related to pressure. Same with the eye. Fluid comes in and out and it's circulated to keep healthy. But if there's a clog in the system and it builds up too much, that can be a problem. And that can relate to a whole bunch of different weird things like potential nerve damage. If not caught early enough, it can lead to blindness. Sometimes there's a slow onset, meaning it can sort of build up slowly over time. Sometimes it can be a really fast thing, and if you don't catch it fast enough and get intervention soon enough, it can lead to blindness really quickly. So depending on the type, and the book mentions a whole bunch of different like symptoms and what it's like to experience the onset. And the idea is that if you're starting to experience nausea or headaches or changes in your vision, you should go get it checked out pretty quick. That's kind of the moral of the story here. Sometimes these can be managed by surgery. If it's a quick onset, it has to be taken care of really fast. Surgery is a potential. Or if it's one of those slower onsets, it can be managed by medication. Just kind of depends. So I think that's probably enough mentioned there. If you can't tell already, if you know anything about the eye or you have some background with blindness conditions, or you have like one of your parents is an optometrist or ophthalmologist and they watch this, you're probably going to be like, this is not really how this works. It's because I don't know a whole lot about this. I'm kind of reading the textbook, relaying that information to you, and I'm kind of learning a whole bunch of this as we go too. I do a little background research where I can and that kind of thing. So I feel a little bit self-conscious about talking about some of this stuff because this is not an area of a place that I know a lot about. Part of part of why I feel a little self-conscious, but I don't know that much, is that when I've been around people who have varying different kinds of blindness, um, I don't talk to them about, tell me the medical explanation of what your condition means for you. You know what I mean? I'm talking to them about what are the things that help you get by in the world? How can I treat you the same as I, or what are your unique needs in a way that I can treat you with respect and dignity and all that kind of stuff. So as counselors, that's why I'm kind of saying like, I feel a little self-conscious about this. It's a little bit weird even for me to give this lecture feeling like I'm supposed to be teaching you something when it's all in the textbook and I'm kind of just regurgitating that. So anyway, a little note about context. If you're seeing things that aren't the way, if I'm not explaining them correctly, part of me says, just correct me. That's totally fine. The other part of me says, but then again, I don't care that much because this is the stuff that doctors have to know about, and not this kind of doctor. Other doctors have to know about that. That's their specialty and how they treat people. And we know this other stuff, which we're going to get to in a little bit here. Okay. Anyway, that was a weird aside. Retinopathy refers to any condition affecting the retina, or the retina is the back part of the eyeball where the light comes in, goes through the fluidy, gunky stuff and the lens and all that business, and it gets to the back. That's where we have photoreceptors that see light and see color, and then it's turned into nerve signals that then go back to the brain through the ocular nerve. Most common retinal, or the most common type of retinopathy is diabetic retinopathy, which can have significant medical, social, and financial consequences. Basically what that means is that as a secondary condition of diabetes, it can change the way a person sees and then change a person's lifestyle pretty dramatically. I did work with one person, I wouldn't say a ton, but we spent some time together, and her condition meant that she still had some sight, but it was her sight loss was progressive, meaning it was going to continue to get worse, and it was related to type 2 diabetes. She was a student at the college that I was working at, and the accommodation for her was relatively simple. She had a cane, she used it, and she was really good about advocating for herself, explaining to other people what her needs were, just like she was, in a good place. And the easy enough accommodation for us was when people handed out papers or had something on the screen, if it was on computer, all she had to do was tint the color of the screen green because there was damage to the back of her retina. And so the rod, if you remember this from either the book, if you've read it, or other places, you have these things called rods and cones. The cones are the color ones, and the rods see basically like the acuity receptors. Her cones were damaged in a way that she could see through green filters better than she could without them. So if we had a piece of paper, we just took a transparent, like remember back when the projector screens used transparency? It's just a piece of plastic that's shaped like a piece of paper, and you can put it over something and it tints the white color of it. Because the white color was so bright that it sort of came in and it just made it was like impossibly bright for her to see. But if you put that green filter over it, she could see it. Or if on the computers that she would sit down at, if she could tint the whole entire screen green, it worked for her. And so that's just an example of how an accommodation was pretty simple and pretty basic. But the challenge was not did we have the accommodation for her, it's could we get other people to provide things for her in that way, which is the challenge of working in the disability community oftentimes, is getting other people to understand why it's necessary and then take the extra step to help that person. But anyway, retinal detachment, blood supply separation from the sensory layer is another issue with the retina in the back. Retinitis pigmentosa, it can be a hereditary or degenerative condition, which can lead to loss of vision or blindness. Macular degeneration, it's kind of an age-related thing. We'll kind of just leave those as it is. You can look more into those conditions if you want to. As far as testing, I'm not going to spend a ton of time on what the tests are and how they work, just because for reasons I've already explained, I don't think it's completely necessary. Ophthalmological testing includes measuring refraction. That's sort of the way the light goes in. The field of view relates to the range, both upwards and to the side, by the way. The pressure of the inner eye related to that stuff we talked about earlier, and then potentially disease checks and other things that can help identify where issues might be. By the way, BTW, that's what that means for anybody who's not familiar with the acronym. Most people probably are by now. By the way, ophthalmologists, those are the people that perform surgeries and can prescribe medications. Optometrists do not. So if you've been confused about the differences between those, some people are. Optometrists are the person you go to, like Lens Crafters or Pearl Vision or whatever other place you go to, and they do some tests on your eye, and they can check for glasses, and they help fit you with those kind of things. Optometrists perform surgery and can prescribe medications. It's a little bit of a difference. If you go to a hospital, or your family practice doctor, and you have the potential for some eye disease or something, they're going to send you to an ophthalmologist. If you're just getting fitted for glasses or need contacts or something, you're going to go to an optometrist. So anyway, we've already talked about corrective lenses. If you've ever heard the term LASIK surgery or laser surgery, there's different kinds of laser surgery, but they all relate to correcting that refractory stuff. In other words, if you can wear glasses for refraction issues, but you want a surgery so that you don't have to wear glasses anymore, LASIK is one version of that. So you'll hear that term a lot of, like, oh, I got LASIK eye surgery. It's the laser thing that goes into your eye. That's what it's correcting. Prosthetic devices, of course. If you lose an eye completely, you can get a prosthetic to be put into your eye socket. And when it comes to understanding how this relates to a person who wants to maintain a body image or whatever, do you remember the old days? You see this in like pirate videos and stuff. People who lose an eye in their scallywag lifestyle of being a pirate or whatever it is, and they wear the eye patch. Eye patches are still an option. Of course, you wear those sometimes when you go to the doctor and you have something, for some reason you need to keep debris out or keep air out or something like that. You'll still see people wear eye patches a little bit. But the better solution for that is, instead of wearing an eye patch all the time, is you put in a prosthetic eyeball that can look very, very much lifelike too. We're not going to spend a lot of time talking about that. I actually, in my younger years, when I was a little thinner and a little more attractive, I dated a girl who had a prosthetic eye, and it didn't work out. But it wasn't because of her eye; it was completely other stuff. But it would be interesting to talk to some of you all about. If you've ever had somebody with a prosthetic eye or have one yourself, what does that mean for you and your lifestyle? And mention things like self-esteem and self-concept. Those are the things that as counselors we get to talk about and get to work through with people. So enough said about that. Assistive devices. I already kind of talked about one version of one specific accommodation that worked for people, but there's a ton of stuff when it comes to blindness and low vision that can be options for people. They're not all perfect, but from talking watches, Apple Watches are now becoming relatively common. And they can sort of say things to you about your calendar and about who's calling and just like all those kind of things. That can be an option. The book mentions raised dial oven dials, being a little redundant there, but there are all kinds of ways around the house that you can use things like Braille or other solutions just to say, like, here's how you read the oven dials. And there's all kinds of little things from, I don't even know exactly how to what to explain the options, but people use touch a lot if you can't see, obviously. And so touching things like the oven dials can be really helpful, not only for safety purposes, but just for understanding symbols and that kind of thing. Magnifiers, of course, text-to-speech software, really common for navigating the computer. JAWS is just one version of that if you've ever heard people use it. It's really interesting. If you use a text-to-speech piece of software, like you're doing that practice thing where you blindfold yourself, and you use text-to-speech, the speed at which you understand what's going on the screen is something that takes total getting used to. But if you listen to people who use JAWS regularly, the speed is magnified times, times a bunch. And it kind of sounds like this. It goes really, really fast. And that's because they get so used to hearing things so quickly and consuming information auditorily that it just sounds so foreign to many of us who who need to process things at a slower speed. It's really interesting how different sensory functions compensate for others when there's something lost too. We'll talk a little bit in the next one about hearing loss, and so sight, how important sight is to those people, and touch as well. That can be really interesting to talk about. Anyway, I already explained the green sheets thing. Most people know about Braille. There's a bunch of options. There's Braille printers. There's even Refresh Braille, which is a reading computer text. So like it kind of has these little bumpy things that pop up and move across, whatever. So we could spend a ton of time about options. Again, this is an area where I'm just not an expert. So I don't want to spend a time talking about things that, for those of you out there watching this, you're probably like, this guy clearly doesn't get it. Again, I clearly don't, because I haven't spent time on this. One of the things that I'll mention here, just kind of in passing, and I won't say much about it, is that because blindness has been a condition that we've been aware of since early in the 19th century, 20th century, early in the 20th century, I had a little brain fart moment where I was like, is it the 20th century or the 21st? I always get that wrong when I'm trying to do it quickly. Early in the 20th century, people were coming back from World War I. This is like the early days of voc rehab and rehabilitation counseling. People were coming back from World War I with eye conditions, right? This is the first time that we used like heavy, there's always cannons around, but now we're using bombs, and the warfare was just so much more grueling that people were now coming back with particularly sight loss, hearing loss due to the loud booms of the explosives, and amputations because of the way that explosives hit the ground, and there's still lots of infantry warfare and that kind of thing. People were coming back with amputations, so missing limbs, sight and vision loss. And so as a result, there have been programs like government programs and a long history of special schools and places where people could learn things like Braille. And it's just been around for a lot longer. So there's been probably more time for us to adapt and accommodate for these kind of things. So there's a lot to be said about that, and I'm clearly doing an insufficient job of it in this class. But nevertheless, some stuff to be aware of. As far as mobility and getting around using sighted guides, that's like a person. By the way to do this respectfully with somebody who has vision loss is to hold their arm. If you hold out your arm, sometimes they'll grab yours, or sometimes you can, there's another way to like hold a person's wrist. It's hard to do this when you're watching me like this, but hold their wrist and then put a hand on their back or something like that to help guide. There's a really fantastic, was it a podcast I think I listened to one time about a guy. He tells it's like a short 20-minute show or something. Tells a fantastic story about how he navigated getting down out of the World Trade Center during the 2001 bombings. And fantastic story about how he communicated with the firemen and how he got out, and his guide dog and this other guy who was there helping him was kind of like helping him navigate. Just a wonderful, wonderful explanation of how a person advocates for what they need in those situations, the misunderstandings of other people, the relationship with the guide dog or another person guide. It just was like so just a wonderful explanation. So I'll see if I can find it if anybody wants me to. But of course, we know a little bit about guide dogs. There's a ton to be said there. Canes are really fascinating. If you ever hear somebody talk about their cane and how they use it, it's so much more complicated than just like waving it around to not hit and walk into stuff. It's there's oftentimes a special ball on the end that actually has a bearing inside of it, so it rotates, and so it kind of like wheels along sideways laterally as a person is moving. And the sound at which people get really used to the sound of the tapping of the cane. And so you can tell if you're walking on grass or carpet, how thick the carpet is. Are you walking on cement or asphalt? Are you walking on paved roads or potentially like cobblestone roads where there's a risk factor of tripping or something like that? It's just like the incredible amount of information you can get through sound through a cane like this is just, it's unbelievable. Electronic devices that can tell when you're getting near something, they could, emit sounds or vibrations or whatever that can help. There's some of these are for safety. Some of them are for functioning, probably both actually. And there's just so many new technological options now that can help out with these kind of things. So fascinating stuff. Okay, I'm just going to check to see how many slides we have. This is the last one. Good. Anxiety during vision loss or fear of losing more sight. There are people who are born without vision, and there are people who acquire vision loss through life. It impacts people in completely different ways, but for the person who's losing their vision, it can come with some, just imagine the grief and loss process for losing a person or functioning of any kind. It's very similar here. Fear of losing more sight can be a condition. The loss of activities that a person used to do, all these kind of things are in play here. This is part of the adjustment process, emotionally and psychologically. It might mean the gradual and voluntary giving up of activities, which can be a very difficult thing for people. Imagine if you all of a sudden were told that you couldn't drive anymore, and you're like, the frustration that comes along with that, the irritation, the need to depend on other people in a way that our self-reliant, egotistical selves sometimes struggle with, right? There's also this, if people can't tell that you're blind. So one of the things I've heard from a cane user before is they said, sometimes I carry around my cane even when I don't need to, just so people know that this is something that is going on with my life. In other words, imagine you're driving down the road and someone says, "Hey buddy, watch where you're going." And you're like, "Well, I can't," People have a different sense of ways of interacting. It doesn't mean people are more nice or more compassionate, but sometimes it can change the way people interact with you if they know that you're doing the best to watch where you're going, but if you have a cane holding there, they'll say, "Okay, I'll move out of the way," instead of assume that you can do everything I can do and then bump into you and say it's your fault, right? Stuff like that. So public ridicule can be just one of those stupid side effects that, boy, it'd be nice if we didn't have it. But this is one of the processes of okay, I have to have this cane. By the way, this is kind of a side note, but it's related here. My dad recently had knee surgery, so he could, get a knee replacement. And he was like, "Oh no, I'm not using that stupid walker around the house." He's just kind of acting a little stubborn about it, It was his pride as an issue. When he would go out, there was no way he was going to carry that walker, right? Because it sort of damages the ego, damages their sense of pride and their sense of self. And that can be true of somebody who's using any of these accommodations. You may not want to put on a hearing aid. You might not want to use a cane. You may not want to have that walker around. But sometimes, and this is sort of the process of adjustment, sometimes having that around is less for you and more for other people, so that other people don't treat you in a way that says, you're just not fast enough, you're not getting it, you're whatever. But if you have some cue for other people, that sometimes can be a way to help them understand a little bit about you. It's kind of like an advertisement of your needs, something like that. So there's a whole conversation to have there that I don't want to have right now, but it can relate to this kind of stuff. So as you can imagine, age of onset matters. Relearning of activities takes time. It's hard to overstate that, meaning it's pretty important, the learning process. So one of the things that we haven't spent probably enough time on that I'll take a minute here to explain is that the relearning activities combines this, okay, I have to get over my pride. I have to be willing to choose to learn these new things. I have to grieve the loss of my old self, the loss of functioning, whatever it might be. I have to learn to not only use this tool, but also see myself in a different way. It's adapting that self-concept. So when I say relearning activities takes time, some of it is, I could pick up, what's a good example? I could probably learn Braille fast enough, right? Like if you were taught that, you gave yourself I don't even know how long it takes, 6 months to a year to learn another language, but then you continually engage with that language. But then there's this whole psychological process of adjustment that's part of that learning time. It's part of not only do I actually understand the words, but do I know how to use them and when to use them, part of the culture. How do I see myself as a user of this language? This probably happens with all languages that you learn. But it's all of that stuff that comes along with this, that when we talk about it takes time. Sometimes you can learn the actual skill, but then developing a self-concept can be a completely different thing. When it comes to counseling, this is an issue too. that we think of as educators sometimes, or we hope to try to, is that there's the concepts of active listening, summarization, paraphrasing, all these specific skills of active listening. And then there's this other stuff too. There's this, how do I see myself as that kind of person? How do I view myself as someone who is consistently engaging in self-care? Because it's important to be psychologically healthy if you're going to be counseling other people about being psychologically healthy, right? There's this whole self-concept and development of maturity and the right character and all that kind of stuff, and seeing yourself as part of that identity. That's part of this too. When I mentioned that the blindness services have been around, oftentimes, I'm going to bite my tongue here probably, but most states have, if not all states, I'm not really sure, but state services for the blind, there's a specific program for low vision and oftentimes deafness too. Because they've been around a long time, because there's public acknowledgement of the need for these kind of supports and that kind of thing. There is even, there's a bigger support community in terms of other resources too. That's probably self-explanatory given what I've already said. But then there's even legal supports, like the ADA requires that the federal government provide services and special programs. And so even at the legislative level, there's an acknowledgement of this specific condition, which means something. Does that mean it's good enough? That's a conversation for a debate, or it's a controversial thing, right? But there is some acknowledgement of vision loss to varying degrees, and the need to understand it, accommodate it, support it, that kind of thing. So it would be interesting to have a conversation about the acknowledgement of the condition of blindness or deafness versus these other conditions that we see and the challenges with them. I think mental health is on the rise of understanding psychiatric conditions and how to accommodate these things. We're on the rise of understanding and prioritizing that over other conditions, which would be a fascinating conversation to have with all of you of what does that mean for, are the accommodations good enough? Are they done in the right way? All that kind of stuff. So, and then lastly, due to the reduced perception of others' expressions, other not being able to see others' expressions, other people's awkwardness or other visual cues, one of the things that can be helpful is assertiveness training. So, perfect example of it, a guy that I met that was completely blind, couldn't see anything, not even light, whatever. He was so much fun to be around, and he was so funny because he really adapted this sense of, I'm going to ease other people's awkwardness and I'm going to ease their concerns. It's sort of an assertive way to say, when I walk into a room, I'm going to announce my presence and by making jokes and making the atmosphere light. And not only did he have the character that really brought joy to other people and brought, helped them get out of their own stupid, crabby places sometimes. It was also a way for him to say, instead of you having to ask how to engage with me, I'm just going to share that with you. I'm going to tell you that engaging with me means playfulness. It means lightness. It means not feeling uncomfortable about engaging with me about your questions and that kind of thing, which is something that I've mentioned that before, and we were talking about spinal cord injuries, is building this assertiveness to talk about yourself and your needs can be a really good way. There's a whole, again, we're getting into controversial territory here, but there's a whole argument to be made for, well, it's not my job to teach other people how to interact with me. And there's a case to be made for that. And yet there's also, it is your job. It is all of our jobs to tell people, here's how you can understand me and here's what I need from you. But it's a two-way street, right? Like other people have to meet you where you are and participate in that. That's why it takes two to tango, so to speak. Especially when it comes to telling people what I need help with and what I don't. Remember that podcast I alluded to earlier about coming down the Twin Towers? And this, it really highlighted this idea of sometimes there are situations where you have to tell people what your needs are. Sometimes people want to help you and they just don't get it right. Just for example, in the Twin Towers thing, the fireman came up and said, here, I'll help you out. And the guy's like, no, I don't need it. I'm good. I have this guy here and my dog here. And like, I'm good. And the guy's like, no, I insist. And he's just trying to be a good guy. And sometimes people are a little dense and aren't listening, especially in the case of crises or, traumatic events and stuff. You can imagine the stress that this guy was into. And so there's a whole mix of considerations to think about. But that's one of the things that we're talking about. We're talking about relearning activities takes time, learning to be assertive with other people, learning what your needs are and sharing those, and then developing the kind of character that says, I'm a safe, comfortable person and I can advocate for myself and other people don't have to feel weird about it. And all this kind of stuff relates to the therapeutic adjustment to disability that we as counselors work towards. So hopefully that is a nice little recap of saying, here's a little bit of what you could kind of consider as being the counseling stuff. Now, what I would love to do is I would love to spend another half hour, or a whole entire counseling program talking about that specifically. But that's for a different time, different class, different interventions, all that kind of stuff. So anyway, I'll leave it there and I will talk to you all later. See ya. Oops, I hit the wrong button. Some of you probably heard the beeps. Anyway, okay, now try again. See you later.